Hello, everybody, and welcome to my channel. I am Dr. Z. I'm a clinical psychologist specializing in transgender care. So, welcome on here. If you are new, please make sure you subscribe so that way you don't miss a video from me. If you are not new but have not yet subscribed, what are you waiting for? And also make sure all of you follow me on Instagram. Link is below. That's where I show up daily. That's where you can get a hold of me daily. That's where I give you tips, advice, and answer you Q&As. Definitely a place where you want to be. If you need support, if you need guidance, whatever you need, make sure you follow me on Instagram. Again, link is below. For today's video, I'm going to discuss how your personality type, your personality predisposition, let's put it that way, is going to affect not only the way you're going to experience gender dysphoria, but is going to affect how you're going to decide or not decide to move forward. And I'm going to give you some tips, some advice, and some guidance. What do I mean when I say personality type? For starters, we're not talking about personality disorders, and we're not aiming at pathologizing anybody out here. Generally speaking, most of us human beings do tend to have certain predispositions that, in my experience, fall into one of the three groups. Some people tend to be more anxiety prone. Again, this is very different than having generalized anxiety disorder. Anxiety prone individuals are people who I would say tend to, when things happen in their life, big things in their life happen, such as, for example, gender crisis, gender transition, other big obstacles, other challenges, you are going to be more prone to rumination, where you're thinking about things over and over again, getting into that cyclical loop. You can't sleep, you go to sleep thinking about it. You're going to be more prone to catastrophizing, thinking about the event, and imagining or telling yourself a narrative of the worst things that is going to happen. It's almost as if you're anticipating the worst possible scenario. You're going to be prone to also getting into the cycle of overthinking, overanalyzing, which eventually is going to lead you to paralysis analysis. That's the anxious type. Usually, when I tell people about anxiety or predisposition to anxiety, a lot of people tend to know right from the get-go whether they're anxious types or not. So if you're watching this, you may already have an idea whether you're prone to anxiety or not. And if you're not, think back at any kind of big life situations or life events and ask yourself, how do you usually tend to respond? Do you usually tend to react? If you do tend to react, how are things keeping you up at night? Let's say something happens, are things tend to keep you up at night and you mulling over it? I myself, for example, just to give you example, a little bit more toward anxiety, anxious type, although I'm pretty much neurotic, and I'll explain what it is. The second most common type of predisposition that people tend to possess is the opposite of anxiety. So if you think about spectrum, right? Anxiety would be over here. And on the opposite end would be depression, depressive type. Again, we're not talking about people who actually do struggle with clinical depression. We're talking about predisposition. What does this mean in this case? It means that when things again happen to you, big events, gender crisis, gender transition, other challenges and obstacles, you tend to look at it through a more depressive lens. You tend to apply a more depressive outlook on it. You tend to suddenly, so whereas the anxious types, right, are catastrophizing and they're freaking out about the worst case scenario, the depressive types are going to feel hopeless. You're going to feel as if nothing is going to change, as if there is no possibility. You're going to want to throw in the towel. You're going to want to give up. You're going to ask yourself, what is the point? It's a tendency of seeing the glass as half full. That's a more depressive types of mindsets, right? So again, it's a spectrum. And anxious people are people that are driven by a tremendous amount of energy, because it takes a lot of energy to keep those thoughts keep going in your headspace. So because of the tremendous amount of energy that needed to keep this type of propensity going, that's why if you're anxious type, you are more likely to experience, and you know this, a lot of fidgeting, a lot of restlessness. Maybe sometimes when you sit, you can't help but you're shaking your leg and you can't stop it. So your nervous system is going to pick up on that mental anxiety that you're experiencing. Depressive predisposition, on the other hand, actually requires less energy. It's the opposite of this. So, as a result, the depressive individuals or people with depressive predispositions are going to come across as uh, kind of tired and melancholy, having opposite of having a lot of energy, lack of energy. Um, Feeling like it's very difficult for you to even move around. Again, we're not talking about clinical depression, no, we're talking about clinical anxiety. Remember, we're talking about predispositions, and you already may be watching this knowing exactly where you fall. Neurotic types are somewhere in the middle. They're people that tend to, depending on circumstances, feel a little bit more anxiety, more depression. They tend to apply either one over the other mindset, but they tend to kind of dance between the two and they land somewhat in the middle. That's me. I am very, very much neurotic. I'm very grounded. Very challenging things happen, I may experience a little bit of anxiety. If anything, I'm neurotic, leaning toward anxious type of mindset because definitely very difficult for me to experience depressive energies. And in fact, I personally struggle to be around people who have depressive predisposition because it's so opposite of my own predispositions. This is also a clue to all of you. Watch who you surround yourself with. Who are your friends? If you're very anxious type, I guarantee you're going to have a hard time being around people who are predisposed to depression because, again, you have so much energy, they have so much lack of energy, and just the mindsets are so different. You're actually thinking about the future. Anxious types are thinking way too much about the future and worrying about the future. Depressive mindset are doing the opposite. They're not thinking about the future. They're thinking about the past. They're thinking way back in the past, but they're not very present and they're not thinking about the future. So very different. By now that you know about three most common, there's the most common, I would say, personality characteristics. When I consult with people on the phone, when I see a client for the very first time, I'm able to pinpoint immediately. That's again occupational hazard. Of course, I deal with thousands of people. For me, it is a slam dunk at this point. I'm able to pinpoint very fast what is their typology. And knowing their typology is incredibly instrumental in me working with them and incredibly instrumental in understanding how they experience gender dysphoria. Remember how I always say no two people are going to experience gender dysphoria exact the same way. Why? Because of this typology types. On top of that, what I'm not speaking about in this video, but I want you to think about, let's layer, imagine layering now this predisposition that you have with your circumstances, your upbringing, also any other things that are going on. Do you have personality disorder? Do you have, for example, mood disorders? Are there other things that you're struggling with? What are your coping skills? What are your strengths? What are your weaknesses? What is your ego strength? All of those things are going to add additional vital information, at least for me. This is what I look for as a psychologist. This is my job. My job is not to look at each person through a very generic lens of gender dysphoria, because then I am not getting them anywhere. My job was to look at how they experience gender dysphoria through their lens. It is as if I'm wearing your prescription eyesight and experiencing your relationship to your gender through your inner self. So why is it so important to at least know the typology and where you land? Here's where. If you are prone to anxiety, if you are prone to rumination, catastrophizing, you need to understand that the way you're going to experience gender dysphoria is you're going to experience it in this. The metaphor I want you to envision is running on a treadmill and struggling to get anywhere. Because you, as anxious mindset individuals, are going to actually think about the future. You want to change the future. You want to feel better. Maybe you want to go through gender transition, or maybe you want to start anything in your life. But yet, because you're ruminating, you're overthinking, you're catastrophizing, you're planning the worst case scenario, and then you're trying to plan how you're going to avoid the worst case scenario, which gets you into this loop of information where one information comes in and then another comes in and it tips over that information and then another comes in. And so your mind is constantly overthinking everything. So you're on a treadmill and you tell yourself, I know where I'm going, but because I'm constantly overthinking every step of the way, I'm making very little, if at all, progress. That's what you need to know about yourself as individuals who are prone to anxiety. You're also going to catastrophize the heck out of potential outcomes. When I say the heck out of it, is I mean you're going to blow it out of proportion to the point where your head is going to spin out blockbusters that are nowhere close to reality. People who I work with who tend to be anxiety prone are individuals who will just, they feel like a certain sense of knowing that if they come out, that is it. The world is going to reject them. That is it for sure. Everybody at work is going to turn against them. The reality is, seldom happens. So this is just an example of how an anxious prone mindset can take something so far. What does it do for you in your gender transition path? What it does is stalls you. It stalls you from taking the steps, because the more you catastrophizing, the more you induce yourself with fear. The more fear your body feels, the less likely you're going to take those steps, because then you confuse yourself and you interpret that fear, or I should say, misinterpret that fear for an indication that you're not ready, an indication that now is not the right time, an indication that you have to wait, and you're on this treadmill going, waiting for the right time. All along, what you're doing is you introducing more and more fearful scenarios into your gender transition. So you're going to be on a treadmill going somewhere, but not getting there, or not getting there nearly as fast enough as you should. Here's my tip for you if you're anxious type. And if you're listening to this and you're like, I'm more depressive mindset, when are you going to, I'm going to get to it, I promise you. So make sure everybody stays to the end of the video. So what can you do if you are in this camp? The best thing that is going to help you is to get out of your head. The best things that is going to help you all is get outside of your head spaces. You're going to have to ground yourself. The best way to reduce anxiety is through physical exercise. Go for a walk, go for a run, go for a jog, go on a bike ride, go on a hike. Do some kind of physical activity to get out of your head and into your body. Once you're out of your head and in your body, sit down and concretely write down where are you heading on your treadmill and what is the first 1 to 2 to 3 steps, small steps you can take. Then, while you in this grounded state, write down what are all the pros and what all the cons. Having a concrete objective list is going to always help you feel more anchored to a more objective sense of your relationship to yourself versus spinning blockbusters inside of your head. So this is my tip for the anxious prone types. Now, in this video, I'm not going to discuss neurotics, because neurotics, in my experience, don't really have challenges, the same challenges list, that individuals who are prone to anxiety or prone to depression too. Neurotics, there's sometimes things that stall you, there's sometimes things that hold you back, but all in all, because you have so little of each end of a spectrum, you're fine. All of my neurotic clients are fine. And I know that all of you watching who fall into neurotic camp are fine. So at least fine in relative terms to these two other groups. Now, those of you who are tend to depressive mindset, my heart goes out to you, because that is that's in my opinion is more challenging mindset to combat than the anxious type. For starters, because at least the anxious types have so much energy. They just need to know how to funnel and channel that energy, how to really focus that energy and what that energy focus. And if they can keep themselves focused, they're so good to go. Depressive prone mindset, on the other hand, are lacking that energy. You're lacking that vitality. And part of why you're lacking that vitality is because you're predisposed to telling yourself anytime challenges arise is that there's no point. that it's pointless, it's hopeless. You may be even telling yourself things such as, what's the point? One day I'm going to die anyway. What's the point? The world is falling apart. What is the point? It will never get better. What is the point? It's going to take so long. What is the point? I can't afford gender surgery. What is the point? My spouse is not supportive. So you're prone to telling yourself all of this things, seeing your situation from a perspective of nothing is ever going to happen. You're also going to be very filled and very riddled with a lot of regretful thought patterns, such as, it's too late now. I should have done it earlier. If only I did it sooner. If only I did it when I was younger. So, again, the difference is the anxious prone mindset are actually thinking about how to do it. They just can't select one option and stick to it. You're not even thinking about how to do it. You are too busy convincing yourself how it's over with. You're doomed. It's done. It's never going to get better. It's a very challenging mindset to go through life with. It's a challenging mindset because that's a mindset that has shown you throughout the life, or you had experiences in your life due to this mindset where you have given up on certain things in your life. And maybe it's a project you took or endeavor you took. And so it also becomes like a self-fulfilling prophecy where those things in your life are then become this what you see as you drive forward in a rear view mirror, this confrontation of, see this happen, see I'm right, nothing is ever going to happen. And it's hard for you to recognize and realize that the reason why nothing is happening is because of the way you're thinking about your situation, is because of the way you are perceiving your situation. Individuals who are prone to depression, if they decide to go through gender transition, and I hope you do, if you decide to take any steps towards your authentic selves, one of the things that you need to watch out for is this capacity to really pull yourself back by your shoes, literally pull yourself back by convincing yourself that it's never going to happen. The key for individuals with a depressive mindset is going to be keeping the momentum going, is going to figure out what motivates you and sticking to that. Because unlike the anxious types, you actually, once you have a course of action and plan, you can totally do it. I've seen it 1,000 times. You can totally do it. But what holds you back is that uh, little person inside of your headspace gets in there and starts telling you that, why bother? Why bother? Why bother? So what's going to help you the most is to create a vision board, is to either have a picture vision board of the future you're heading to, or have things written down, your goals clearly outlined, morning affirmation of very clear statements of where you're heading. You're going to need those things to keep reminding your psyche, to keep reminding your mind that you have a goal, that it is going to happen. And every little achievement should be highly celebrated by individuals who are prone to depression, because that's proof. That's a valid, concrete proof that things are getting better. And that's exactly what depressive minds needs in order to get out of seeing everything as never going to happen, of getting out of this hopelessness and helplessness that you feel. That's my biggest tip to individuals who are depressive prone. Also, surround yourself with people who are supportive. Surround yourself with people who are also going through gender transition, because they're going to help you. Their motivation, their momentum is going to rub off on you. For individuals who are prone to anxiety, the best thing that you can do is to avoid spending so much time gathering information on the internet, Reddit groups, Facebook groups, from anybody who is not somewhat knowledgeable in a field. Stop doing that, because what you're doing is you're interjecting ideas, thoughts, opinions of people who are not knowledgeable enough to give that opinion. Having gone through gender transition does not give a person qualifications to speak in at least generalized broader term about gender dysphoria. I'm sorry, it does not. It gives you privilege to speak about your personal experience and what it was like for you. But what happens is that people often speak about their personal experience as if it is everybody's experience, and then people interject those experiences as dogma. You need to either listen to yourself and follow your own beat of the heart, or I think I said it wrong. So yeah, one of you is going to comment below and share how properly to say that. Um, or you need to find people like myself, yes, like myself. And even though I don't have transgender experience, because I've been in this field now getting to 20 years and I've been working only with trans adults, I've seen anything and everything. I don't think there's anything that I have not yet seen or experienced in regard to gender dysphoria. This is why I'm able to comment here and to create content and to give you an explanation and to give you an idea of what might happen. So this is really, really important for anxious types to stop collecting information from people who are not in position to be giving that information. Okay? Not all information is good, especially in today's day and age. Again, for individuals who are prone to depression, my heart truly goes out to you. That is quite challenging. I'm not going to lie. I'm not going to sugarcoat. That is challenging mindset. It's a very challenging mindset to live a life with. But for both mindsets, what I'm going to finish this video on is telling both of you that not only is it possible, but it is highly probable to shift your mindsets more toward neurotic middle. Not only is it possible, it is highly probable to shift your mindsets to more neurotic middle. Your brain has capacity to reroute, to recalibrate the way it thinks, the way it sees the world, and the way it interacts with things. So don't you ever, ever forget that none of you are ever doomed. None of you are ever doomed with your thinking patterns. Thinking patterns can always change and be disrupted. There's always has been paradigm shifts. Think about the way you thought about something 5 years ago, even a year ago, and chances are you're thinking about the same thing differently today. So hopefully this video was helpful. It is incredibly helpful with clients that I work with when I pinpoint their type of predisposition, and then I explain, oh, this is why you're doing this. This is why you're thinking this way. This is why you're having this anxiety. This is why you're experiencing depression. It helps tremendously because then people can actually orient themselves in the right direction. Comment below, share what your thoughts are, and I will see you all next time. Bye.